Morning from USA and good evening to all of you, all the doctors and the young medical students, professors, and any part of the universe. So, good morning from here, and good morning, Dr. Faina Linkov, and she is the department chair and Department of Health Administration and Public Health, and she is the one who is going to lead us into the professional growth through experiential learning and all the opportunities our medical doctors and students and anybody else who would like to come to USA to Duquesne University. You're welcome. And we open the floor to Dr. Faina Linkov. Please, good morning, Dr. Faina. Please, the floor is yours, and please address our students and our staff and anybody who is listening. Thank you. Please welcome. And thank you, Jeff, for waking us all up. Thank you.
Thank you so much. I'm really honored to be here with you today and to present about our school and our potential collaboration. Before I get started, I wanted to thank the organizers for organizing this wonderful event, especially Dr. Shiva and his colleagues. And also, I want to thank all of you for making time at night to meet with us. I understand that your time is valuable, so I do appreciate you coming here today. Before we started our official part, Dr. Shiva and we just talked about how some students in India may be a little bit shy in terms of asking questions. So today, what I want you to do is think about one question that you want to ask and make sure you ask it before the session is over. If you don't feel comfortable asking it through this forum, please email me or email Dr. Shiva. We want to be able to interact with you, and we want to be responsive to all the questions and all the concerns that you have. We want to build collaborations with you, and we want to work with you, and this starts today. So thank you so much again for having me here today. Dr. Shiva already introduced me, and what I want to add to that introduction is, other than the department chair, I'm also an epidemiologist. I am extremely excited about research of any kind, but especially in the areas of health administration and global health. And I've been involved in research for the past 23 years. And I'm excited to work with all of you on various experiential learning experiences, but research is one of my greatest passions. So today I'll be talking about professional growth through experiential learning. Next slide, please. What we are doing today is introducing our school and also introducing the Master of Health Management Systems program. We did have a seminar a week ago where our dean, Dr. Fevzia Kinsey, went into many, many details about this program. But for those of you who are joining today for the first time, I wanted to emphasize some of the key components of our program. We are Master of Health Management Systems Duquesne. It's a 30-credit program that can be completed in 1.5 years, but you can come as a part of this program for 2 years to the United States, and you'll have a free summer and free spring semester to explore shadowing opportunities, to explore work opportunities, and to explore all kinds of opportunities to make a case for your application for residency program if you choose to pursue medical path and passing USMLEs after your graduation. We have innovative and competency-based curriculum where we constantly talk about the business applications of what we are doing and also opportunities for becoming entrepreneurs. Because healthcare environment, it's evolving every day. And unless you have the business skills that we're trying to give you, you may not be successful moving forward. As a part of our program, we have industry experts who serve as adjunct faculty members in our program. They represent large healthcare organizations such as UPMC, University of Pittsburgh Medical Center, Highmark, and Allegheny Health Network. Next slide.
Next slide, Jeff.
Okay. So as a part of Master of Health Management Systems at Duquesne, we have hands-on opportunities for experiential learning. We study a lot the ways that students learn, and we now understand that students do not learn from lectures. So I'm lecturing right now, unfortunately, but I would much rather sit with you in the same room and talk to all of you and give you an opportunity to talk. So what we are learning is that learning happens by doing. Learning happens by hands-on experiential learning experiences that I'll describe today. You'll have research opportunities with our program faculty, and you'll also experience one-on-one mentorship by our faculty members for personal and professional development. Through different conferences and events that we have on campus, you'll get opportunities to network with local and regional healthcare systems. And all of those experiences will help you to get into a residency program of your choice after you graduate. Next slide. In our programs, not just this one, but in all of our programs, we teach competencies. So the key leadership competencies that we teach as a part of this program are communication and relationship management, leadership skills, professionalism, knowledge of the healthcare environment, and business and analytics skills. And throughout all of our competencies, we keep thinking and we keep implementing the concept of educating you about business and entrepreneurship, because that's a key to success in today's ever-evolving health environment. Next slide. A few words about our department and what makes us very unique. First of all, I wanted to mention a few words about some of our graduates, where they are and what they do today. So we have a director of education in one of the programs at the UPMC, which is University of Pittsburgh Medical Center. We have a consultant and senior engineer at the Centers of Disease Control in the local office here in Pittsburgh. We had the lead order coordinator for pharmacy. We have at least one administrative fellow. We do have senior network specialist at United Health Group. And I think what's important to mention about our program, and this is represented on a picture to my upper right corner, is personal attention that you'll get from our faculty members. So this particular slide represents our dean, Dr. Fevzi Akinci, treating our students to a Turkish coffee. So he is a big fan of coffee, and he always invites our students to share a cup of coffee with him.
Yeah,
And
I had the opportunity to experience that. And also, I want the students and doctors to understand that UPMC and CDC and all these United Health Group, they are huge and very large companies. They are multi-billion dollar companies. And I want the students to know that going through Duquesne, this program of HA and PH, these people get the skills to lead all these huge organizations. And it is very important that you may not want to go and do residency. You may not want to do medicine after that, but it is okay. And just like many of us who need to have other experiences, other skills to lead other organizations which are also supporting the healthcare systems. So, being a part of a Duquesne master's program will enable you, give you all the skills to lead large companies which are taking part side by side with the main hospital systems. Yes.
thank you so much. That is absolutely correct. And geographically, we are located right next to all these major healthcare systems and all the major hospitals. So in my window, you can see a little bit of downtown Pittsburgh. So Mercy Hospital of UPMC is located literally 2 or 1 block from here. So you're in the middle of action. You're located right next to major and huge healthcare organizations with lots and lots of opportunities for work and professional growth. In terms of some other things that our graduates do, we have our students working in the leadership of human resources departments. We have one person who became a vice president of sales, project managers, purchasing managers, center director of operations, and so at least 2 software release managers. Next slide, please. So today I'll be talking a little bit about experiential learning and what we do for experiential learning in our program and in general at Duquesne University. So experiential learning is the process of learning by doing, and it's the foundation of our learning experiences at Duquesne. We are engaging students in hands-on experiences and reflection so that they are better able to connect theories and knowledge learned in classroom to real-world situations. Next slide. And this slide dedicated to the framework of experiential learning is a little bit complex, but the bottom line here is that we are trying to connect you with concrete and real world experiences so that you would be successful when you are done, not just in your medical career, but in any career that you possibly can choose. And Dr. Shiva already alluded to the wide variety of options that will be available to you. So we're giving you the skills and competencies for you to be successful in any pathway in life that you'll choose. Next slide.
Right.
So today I'll be talking about 10 key experiential learning opportunities that we give to you at the Department of Health Administration Public Health. And one of them, and the first one of them, is culminating study experience, which is called a capstone. And this is a course, but it's also a real life application of the concepts that you learn to a project. So as a part of this culminating experience, you get to choose a real world problem and a real world project. And throughout the course, with the support of your mentors, you're actually implementing this project. So it's a wonderful opportunity for you to get healthcare experiences before you actually join the workforce. And I'll be giving a few examples of that in the next slide. We also have internship and employment opportunities, fieldwork, which is similar to internship, shadowing experiences in major hospitals around the town, community-based service learning, research opportunities and ability to publish papers, volunteering, campus engagement, simulation experiences, and teaching experiences. So in the next 10 to 12 slides, I'll give you specific example of each learning opportunity presented at on this slide. Next slide, please. So as I mentioned before, we have a collaboration with the local office of Centers for Disease Control. And Centers for Disease Control is the major organization in the United States of the United States government that deals with public health issues and solutions for the entire country. So we have a local office of CDC or Centers for Disease Control located right here in Pittsburgh. And this particular office is dedicated to working on personal protective equipment issues, which became extremely relevant during the times of COVID pandemic, where all of us were concerned, what kind of personal protective equipment are we supposed to be using? So a lot of action was happening right here in Pittsburgh with the members of CDC in our Pittsburgh office designing policy for the entire country. So one of our students who was working with us at the height of the COVID pandemic, his name is Eric Quittequid, he specifically designed a project where he compared two different types of personal protective equipment. He was comparing N95 masks with more expensive respirators, and he was looking at cost effectiveness and different aspects of their use to make recommendations for the public. Next slide.
Yeah, just to add a little bit about academics of capstone, I want the young doctors and students to understand a capstone is something like a research project which will come in the entire semester where the students will participate and come up with a research paper, which later they are credited with publishing and they can work with their professors and all, which will put you ahead of the curve for your residency programs. And for whatever jobs you seek anywhere in America, this capstone project will be your research and your name and your paper will have a lot of value when you go further. So I want you to understand capstone means a research project. Thank you. Go ahead.
Absolutely. Thank you so much. So this particular example of capstone project presented in this slide was a research project, as Dr. Shiva correctly emphasized, and it's a new partnership between Duquesne University and Canterbury Place Nursing Home. And the reason why we implemented this project is because this particular nursing home, just like many nursing home facilities in the United States, they're suffering from high turnover of their employees. So the vast majority of employees quit before 6 months of their employment. So what we were doing in collaboration with two master's students named Valerie and Anthony is to create a survey study and also a qualitative study implemented through focus group, where we talked with employees of the nursing home about some of the potential ways to retain them. And right now, these students are working really hard to publish their research. And as Dr. Shiva mentioned, many of these projects, capstone projects, they do turn out to be research projects and publication that really propel you to the residency programs of your choice or any kind of careers that you want to pursue. Some of our projects are not necessarily research, but it all depends on what you're interested in. So for example, we did have 2 to 3 students working on policy projects that were also kind of research in nature, but they were thinking more of a big picture. What can they do? How can they contribute to the change of policy in the United States? So we have a wide variety of capstone projects, and we welcome you to come to us so that we together could pursue your passion and identify a project that best suits your interests. Next slide, please. The next experience that I wanted to share with you is an example of internship experience with the Allegheny County Health Department. And it's our local health department that deals with both infectious and chronic diseases in the Pittsburgh area. So we do have a public health student, Olivia, who just finished her internship with this particular organization. What's really nice about Allegheny County Health Department is just like our hospitals and other healthcare facilities, they're located literally 3 blocks away from us. So again, very close experience that you can take advantage of when you come to Pittsburgh. Next slide. In terms of other experiences, we have field work. And many of our students this semester are working with an organization called Pittsburgh Business Group on Health. And this is where you learn not just public health, not just health administration, but also business aspects of how to get things done in healthcare. This group works a lot with local health insurance companies, and they work with insurance companies to figure out which services should be covered, which services should be free. For example, the group highly emphasizes the need for vaccination coverage, and some of our students are working on vaccine-related projects. So as I mentioned, we have several students working with Pittsburgh Business Group on Health this semester, and many projects focus on disparities, especially in the areas of vaccination and maternal and child health, which is a big issue in the United States. And the head of Pittsburgh Business Group on Health is an advisory board member for our department, which also really helps. So when you come to Pittsburgh, this is one of the opportunities that you'll have to work with an organization that can teach you business skills in addition to other public health and health administration experience. Next slide. Shadowing experiences. This is especially valuable for those of you who want to become physicians in the United States or around the world. We have a student, Liba, who this semester will be observing gynecologic specialties division at McGee Women's Hospital of UPMC, which is located about 5 bus stops away from us. And it's a major hospital for women's issues. And it also has a major institute for women's health research. It's one of, it's actually the best funded women's health research institute in the country. And this is where I actually worked prior to coming to Duquesne. So again, shadowing experiences, especially valuable to put you ahead in terms of your application for residency experience, for residencies.
Yeah, I also want to emphasize that our doctors will have a lot of opportunities in and around Pittsburgh, because it is, as you know, a hub of hospitals and healthcare providers. And not only shadowing, but electives and internships. And there are so many opportunities when you come to Duquesne that you can pursue. And we will always guide you and help you and make sure that you get the best experience of being here.
Thank you so much. That is absolutely correct. So let's move to our next slide. We also provide to our students community-based service learning experiences. And this is where we work with communities that serve underprivileged children and kids and mothers. And specifically, we are working with Jasmine Norrie campus, which is a multi-service campus designed to address multiple needs of residents, including residential services and programs that focus on special needs of the community, such as early child care, recreational issues, educational needs, and other human service related services. So when you come here, you'll be able to work with these communities and meet some of our community members and community leaders. Next slide. Research opportunities. So this is at the core of what we do. So you'll learn the process of research, design, and implementation by actually doing research. You will be able to collaborate with Duquesne faculty members on research publications, participate in local and national conferences to highlight your research and to network with other researchers. And you'll be able to publish your research with the mentorship of Duquesne faculty members. As a part of your research experiences, you'll be able to obtain city research certificates, and these are certificates focused on research ethics, compliance, and safety training. Those certificates will be provided free of charge to you, and they will work not just at Duquesne, but they'll work throughout the United States, because city is like a centralized network, so your certificates will work anywhere, and they'll set you apart from other applicants. You'll be ahead of the curve by having those certificates completed. Just to give you an example, if you complete your certificates to Duquesne, but then you obtain a residency position at Harvard or at Yale or in other schools, you'll still be able to use your city research certificates, and you will not need to take them again. They are good for 3 years, and we'll provide those to you.
And something to add, our number 4 webinar will be from Dr. Heather, exclusively on research and all the topics under research. So I hope all the doctors, junior doctors, senior doctors will be available for the webinar number 4, and which will be focused on research opportunities. Yes, thank you.
Yeah.
Go ahead, please.
Thank you so much. So we did plan 4 webinars. This is the second one. So I hope you can participate in as many as possible. We welcome all of you to all the seminars. So this is just an example of one of our students, Drew Priori, who published a paper with our faculty member, Ahmad Kanjani. So this is just to show you that our students and faculty, they work together to learn the process of publishing, and they do actually publish their research in major biomedical journals. And this particular article was published in Primary Care Diabetes, but we do publish in many different journals. Next slide, please. Volunteering. So we do have a list of organizations. We have at least 20 organizations that we're in regular touch with. And we send our students to a variety of organizations, including Food Bank, Bethlehem Haven Shelter for Women, Global Links, which is an international company, Mercy Hospital, McGee Women's Hospital, and we have lots and lots of other opportunities that you're welcome to take advantage of when you come to us. Volunteering is the kind of experience where you kind of get out of your comfort zone and you interact with people and with organizations that you never were able to be a part of during your medical training or even your master's training. So Food Bank or Shelter for Women, they're serving extremely underprivileged populations, and you get to learn about these populations and their needs. And you'll be able to use those experiences in your own life, in your own personal career, but also to strengthen your applications for residency or other future opportunities of your choice. Next slide. We also encourage our students to engage in our campus activities. For example, students are encouraged to join student clubs, but you can also start your own club. So you can demonstrate leadership from your day one on campus by starting a club, for example. And we typically say, because we like teaching leadership, is that leadership starts on any level. You don't have to wait until you become a lead doctor in your hospital to start practicing leadership. Leadership starts today. We also give you opportunities to participate in graduate research symposiums and conferences. For students with interest in health administration, we encourage you to participate in national case competitions. And we typically have our faculty member, Dr. Ahmad Kanjani, oversee teams of students who like going to these national case competitions. And we also have students participate in student recruitment events. So in this photo, what you see is myself, our dean, and two students. All of us participating in student recruitment events. So, and this demonstrates how closely we work together on anything that we do. And it's not just students working with students, it's students working with professors, chairs, and the deans, all at the same time, which again gives you exposure to more than one opinion, to more than one type of professional interactions. Next slide. What we also do in our classrooms is simulations, because oftentimes we do not know what it's like to be poor or what it's like to put together a budget for a hospital. So to give you an example, in my introduction to health administration class, in one of my classes, we dedicate the entire class to putting together a sample budget. So students work in small groups to simulate the experience of creating a budget for a clinic. So similarly, we do poverty simulations and other types of simulations in our classrooms. Next slide. We also have students help us with teaching, which is an amazing experience for all of us. This June, we were hosting a public health academy targeting local area high school students. So these students came to us for one day to learn about health administration and public health. And I had 4 students, masters, undergraduate, all kinds of students, helping me to guide these young high school students in terms of selecting the career and the study choice of their dreams. So, and this picture was taken during the Public Health Academy with our 2 students at Duquesne and 2 high school students. Next slide. We are going to be working, when you come here, with Duquesne's new medical school that will open up next year. So by the time you will come to us, the school will already be open, and you'll be able to engage with both faculty members and resources of Duquesne's medical school. Next slide. As a part of our library system, you'll also have access to various resources, including different textbooks and guide for you to pass your USMLEs, if that's your choice and if that's your career direction. And in guiding you to pass your USMLEs, we'll be working closely with Dr. Shiva and Unademy Global, because both of our organizations, we have the resources to help you be successful. And again, it's going to be a great collaboration with Dr. Shiva and his team, and we look forward to working with you to have you stand apart from your competition.
Yeah, we will definitely guide, help, support all the doctors who would like any kind of help, coaching, training with USMLE Part 1, 2, 3, and if they want externships and any kind of filling the forms, writing SOPs, support system, and letters of recommendation, it will all be done through Unidemy Global, and we are working hand in hand. And all the students, right from the day they leave India or any other country, they can expect us to be with them. And I want you to know that your success is our only motto. And that's what we are here to do. And we will support you in every which way. Right now, except finding a girl or a boy for you, we are going to do everything. So we are your partners, and maybe someday we'll help you in that too. Okay, next, please.
As a part of your experiences at Duquesne, we really hope that you can learn the concepts and the applications of different entrepreneurship opportunities. Here at Duquesne, we have an office called Duquesne Small Business Development Center. And this center provides no-cost confidential consulting services and educational webinars and workshops to small businesses and those who are thinking about starting businesses in southwestern Pennsylvania. Depending on the level of skills that you have, you may be asked or you may participate in providing that consulting services. Again, wonderful opportunity to engage with the center, participate in the workshops provided by the center, and participate in their events. They will teach you how to become a better entrepreneur and a better business person. We also learn about business and entrepreneurship basics in some of our classroom settings. And we do that through goal setting, recognizing opportunities, learning about financial literacy, and most importantly, being creative and seeing opportunities where they may not be visible to other people. So welcome to Duquesne, where we will all be working together to be better business people and better entrepreneurs. Next slide.
And I want to add one more small information. The best thing about Pennsylvania, where Duquesne is, the state government of Pennsylvania is having an office in Bangalore. So you can imagine the bridge is already there. The state in Pennsylvania is already having an office to set up business, to help support education, everything in the city of Bangalore. So it's just right there in your corner, and you can start looking into developing businesses, entrepreneurship, how you can be a part of it right from Bangalore. So, which is a great thing to have a state representative in our own backyard. Thank you.
Thank you so much, Dr. Shiva. This is absolutely correct. And thank you so much for your great comments. So it is my understanding that the vast majority of people who are connecting to these seminars, they're either students or recent graduates of medical schools, and your passion is to become physicians. However, we do recognize that the medical path is not for everyone. So what sets our degree apart is that we are building on the top of your medical training to give you alternative career path if you do realize that medicine is not your primary passion or being a physician is not your primary passion. For example, you can use this master's degree program to continue your studies in the PhD programs of your choice. For example, you can get PhD in health sciences at Duquesne University or another PhD program of your choice. You can pursue biomedical research career. You don't need to be a certified physician in the United States to become a biomedical researcher. You can join pharmacy industry and assume a leadership position in a pharmaceutical company. You can pursue administrative fellowships, or in general, you can have an administrative career, such as becoming CFO or a CEO of the hospital, healthcare plan, and other interesting administrative career opportunities. Next slide, please. At Duquesne University, we have dedicated Office of Career Services, which is available to all students. And this office organizes career-focused events. It helps with resume preparation so that you will be set apart from your competition with the strongest possible resume. They provide career planning services. They give you access to handshake system to find internship and job opportunities. And in general, they provide individualized support to all of our students. So you can have a one-on-one appointment with them to discuss your career, discuss your preferences, and identify the best path that is right for you. Next slide. With this, I want to thank you. As I mentioned during our opening, I'm very happy to answer any questions that you have. If you don't feel comfortable asking them right now, which I do hope that you'll ask them, this is my email. Please feel free to reach out to me. I typically respond to my emails within 24 hours, and I look forward to talking to you and learning more about you and your preferences and your hopes for the future. Thank you so much for hosting me here today, and I look forward to your questions. Do we have anything in the chat?
Yes. Hello.
Yes, sir.
I'm Natarajan from Hyderabad.
Good evening, Natarajan.
Okay.
Please go ahead.
I am a director in international admissions of a large institution in India. As the lady, the Dr. Paina was talking about, the opportunities in pharmaceutical industry there. In which case, do you think that PharmD program that is there in India, which develops students into a clinical pharmacologist, will she be able to? Will she or he will be able to do this program?
Yes, so our program is open to any clinician. So as long as you have bachelor's degree, you can come to us. So pharmacy schools are fine, dental schools, anything
Yes.
where you have a graduate degree, you can apply for. So, and thank you so much for your question. And please feel free to share materials about our program with your students, because we do love working with pharmacy students.
We have a dental college. I'm connected with the dental college as well as the pharmacy college, where I'm directly responsible for the admissions of international students. So we have a group of, for the last 6 years, we have been having this PharmD program in India. They are not having good opportunities to develop their career in India because it is still nascent in India, clinical pharmacologists. Thank you very much.
Thank you so much.
Please refer to our email, and you can call me anytime, doctor, and we can discuss. We have an office in Bangalore, and you can reach out to me anytime, and we will make sure that your students have an excellent pathway, whether they are dental or pharmacy or medical, it doesn't matter. We will collaborate with you, and you can call me after the webinar is over, and I will be very happy to answer you and all your queries. And even if your students,
Anup Chandra Yadav, you know Mr. Anup Chandra Yadav?
Yes.
Through him, I have come, obviously. So wonderful. I will share my experience with him. We'll come together to you. Okay.
Yes, sir. Yes, thank you so much. Yes, Anup is our young director.
I want to compliment Dr. Paina for an excellent presentation. Thank you.
Yes. We will have her more often, and we will have her address all your students as well. Absolutely.
Surely. Thank you very much.
Thank you, sir. Thank you.
Thank you, Natarajan sir, for the question.
Yes, if there are any other questions, yes, and Dr. Faina, one of the student wanted to know if they can do masters in pharmacology, and I said yes, and I will answer a couple of those questions which are addressed to me, and if there are any things, I will share it with you. Before we close this, I just want you to know that there are many opportunities and there are many schools in Duquesne University, and you are all welcome to choose whichever subject you feel free. And we will conduct more of these webinars, and we welcome students from India. We welcome teachers from India. We welcome management teams from India to visit Duquesne and visit the country, so that our bridge grows very strong by every meet, every visit, every training. And I don't want any staff to feel that they are old or anything. They can come anytime and pursue their studies, ambition, goals, develop careers. And we are always there to support. And I thank Dr. Faina for taking this time with us. And I look forward to seeing you all very soon. And wishing Dr. Fevji a very happy trip. And Jeff, thank you so much. And I hope if there are no other questions, we can close this webinar. Vishwanath?
Yes, sir. Just I had one question, because this the students of the after they having this degree, they will also participate in business management. the prerequisite for the student, is it that they need to have the statistics also? They need to study statistics before they join this course?
So we do not have statistics related prerequisites. The main prerequisite that we have for the program is having a bachelor's degree. So, and if students already had statistical courses in the past, it really helps. However, if they did not have statistical courses in the past, it's not a barrier to their admission.
Okay. Yeah, thank you.
We do have a course that is Introduction to Research Methods and Statistics that assumes basic or no skills in the area. I also wanted to emphasize that our school, as Dr. Shiva mentioned, has many programs. We have a pharmacy school, we have nursing school, we have a medical school. I personally oversee programs that are related to health administration and public health, including the program that I presented today, an MHA, Masters of Health Administration. So I'm most qualified to talk about our programs, but if you're interested in pursuing, for example, degrees in pharmacy, I'm happy to connect our students to the right people.
Okay, any students have any further questions?
Hello,
Anup?
good evening. Hello.
Yes, good evening.
I'm Vinay. Recently, I'm in Bangalore pursuing my third year MBBS degree.
Very nice. Go ahead.
Uh,
Go ahead.
Actually, in 2 years, I'll complete my degree. What options can I have in your university there after the UG, after I get the degree here in India? How can I come there?
Okay. And now, Dr. Faina, you want me to answer that?
Yes, I think you would be most qualified. Yes.
Yes, yes. Okay. Vinay, very nice. Thank you so much. He's from my same school, Sainik school. That is my
Yes,
boarding
sir.
school yes. So thank you so much, dear Ajit. Yes. When you are in your final year or internship, I want you to take TOEFL, that is English proficiency test, and then hopefully GRE by the time you complete your internship. Okay?
Okay,
Do you
okay,
understand
sir.
that? Yes.
Okay, sir.
After that, then you prepare to come to USA Duquesne University for MHMS program. It is a master's program.
Okay, sir.
Okay. And when you are here, it will be for the duration of 1.5 year, 18 months. Okay.
Okay, sir.
Are
Okay,
you
sir.
with me?
Yes, sir. Yes, sir. I'm with you,
Yes.
sir.
Okay.
Okay.
During that 1.5 year, you will be studying all the things which just now Dr. Faina explained to you,
Hmm.
what you're doing for 18 months. And this will
Okay,
give
sir.
you a solid foundation in America. And this is what the program directors selecting you for residency are looking for.
Okay, sir.
Your experience here, your experience in communicating with people here, your experience in research, your experience in talking to the patients, your experience in writing research papers, your experience in handling day-to-day life. So when you are here for 18 months, that will put you ahead of the curve. So you are in the first line, and your program director who wants the best candidates, you will be the preferred one. So you will
Okay, sir.
get residency immediately based on your 18 months to 2 years of experience here.
Okay, sir.
And during that masters, we will also support you in taking United States licensing exam part 1, part 2, part 3.
Okay, sir. Okay, sir.
And then you will also have opportunity to do shadowing externship in your stay at Duquesne University. And we will support you, guide you through that process.
Okay, sir.
Okay.
Absolutely.
And yes,
And the
yes,
key is that we are here to support you every step of the way. We are
yes.
very hands-on in terms of the kinds of support that we are providing to our students individually.
Yes. So
Okay, ma'am.
the whole idea of doing Unidemy and Duquesne and other parts of university is to make sure that all the candidates, all our doctors, young doctors who would be leading the world for unknown diseases, unknown problems, you are going to be the leaders of those times where we don't even know the problems. So you are basically being trained here, giving foundations to become leaders, to understand healthcare, to understand what is finance, to understand how to become a leader, how to become a leader in businesses. And all this will be a part of your education in Duquesne University.
Okay, sir.
And you can visit too anytime.
Okay, sir. Thank you, sir. Thank you, ma'am,
And
for
which
your
medical college
information.
are you studying?
I'm studying in Dr. B.R. Ambedkar Medical College, sir.
Oh, very nice, very nice. So you can conduct a webinar and we will be very happy to address all the students in your college.
Okay, sir. Thank you, sir.
And did you come to Dandeli?
No, sir. I
April?
didn't come there actually.
Okay. There were some students,
Recently,
doctors who.
yes, sir.
Go ahead.
Recently, we had that entrepreneurship meet in the Bangalore, sir. That I
Okay.
attended that program, sir.
Okay. So
And I
now
mean that
you can talk to all your medical students, doctors, and everybody, and you
yes, sir.
take the lead so that we can address all the doctors.
Okay, sir. Yes, sir.
Okay, Dr. Fina, I think we can definitely do that, right?
Yes.
Yes. Okay. Dr. Vinay, any other questions?
Nothing, sir. Thank you, sir. Thank you, ma'am.
Okay.
Thank
You
you
have a
so
wonderful
much.
evening.
Okay, sir. Thank you, sir.
Okay. Any closing thoughts, Anup and Vishwanath? Heather is here too. Hi.
Hi there. Good evening and good morning.
Good morning. Good morning. And I think having you is wonderful. So you know how the flow goes, and we are waiting for your webinar as well.
Looking forward to it.
Okay, great. Thank you, Dr. Fina. Anything else, guys? Can we call it a day?
Thank you so much. I want to thank again all the participants and especially students who found the courage to ask questions. Please continue exercising your courage by emailing me and asking any questions that you have about the program. We look forward to hosting you at Duquesne, and you'll be able to see our Pittsburgh downtown from my window or in general. So welcome, and we hope to see you soon.
Thank you so much, Dr. Fina. I'll talk to you later. Thank you. Thank you, Jeff. I'll talk
Thank
to
you,
you later.
everyone.
Thank you,
Thank
Jeff.